It is a nationwide crisis impacting every one of us. Opioids, legal and illegal, they're addictive and deadly.
This epidemic is a national health emergency.
Lives are being lost by the tens of thousands every year to painkiller abuse and heroin. The financial impact is in the billions. Opioid issues knife across each state, endangering every American city, suburb, and town, all cut deeply by the opioid epidemic. Eric Bowling lost his son to the synthetic opioid fentanyl at his Colorado University.
We must commit to removing the stigma of shame that comes with addiction and helping change public opinion so that people find evidence-based treatment before it's too late.
Stand up and fight the opioid crisis now. Your voice, your future. Opioids, a national crisis, is brought to you by Liberty University. Now, here's Eric Bowling.
All right, well, welcome to beautiful UMBC. That's University of Maryland, Baltimore County, affectionately known from here on out for the next hour as UMBC. I want to say thank you for joining us. This is our 9th Town Hall, Sinclair. We've been going around the country. 9th Town Hall on opioids. We'll probably do 4 or 5 more all over the country. Last week we were in Las Vegas and Seattle, and today we're in Baltimore County. So we have some great guests tonight. James Carroll, the director of the National Drug Policy, is here. Steve Shue from the Maryland Opioid Command Center. Baltimore's new police chief, Michael Harrison, and Sheriff Jeff Gaylor. We're going to start first, though, from the State House in Maryland with our own Chris Papst, who sat down with Governor Hogan and Lieutenant Governor Rutherford. Watch this.
So, as far as the data is concerned, Maryland is in the top 5 for opium and opioid deaths, and this was the first state to have a state of emergency that you guys declared. What has been put in place, and how effective has it been? Let's start there.
Well, look, this is a terrible crisis that's impacting, states from all across the country. We were the very first ones to get on top of this when Lieutenant Governor and I were running for office. We brought this to everyone's attention because as we were going around the state, everywhere we went, in every single community.
Right. Didn't matter if it was large cities, small towns, suburban areas.
Everybody said this was their #1 problem. And it was a little bit shocking back then, no one was talking about it. But we decided to focus on it and shine a light on the problem. As soon as I was elected, I appointed him to chair a task force that held big hearings all around the state to get input. How many different recommendations did you come up with?
We had 33 recommendations ranging from prevention and education to treatment, recovery, awareness and stigma reduction to law enforcement.
So the issue is that we've thrown everything we can at this problem. We've attacked it from all directions. I was the first governor in America to declare an actual state of emergency on this, long before other people even started talking about the problem. We've invested $840 million. We've doubled the number of treatment beds. We've gotten tough on the gangs that are selling these drugs. There's good news and bad news. The bad news is because of fentanyl, it's continuing to be a terrible problem that's killing far too many Marylanders. The good news is we've, on overall opioid deaths, we've slowed the growth this year, and we've actually bent the curve downward on prescription opioid deaths and on heroin deaths, which almost no one in the country is doing.
Right.
So we're making progress, but there's a long way to go.
How much money is put into drug enforcement? I mean, not just in opiums, but in all of them, like cracking down on doctors that are prescribing this stuff to getting it off the streets.
Well, I'm not able to separate that out because, when you talk about the doctors, our prescription drug monitoring program that was implemented the first year and then made it mandatory for all doctors and dispensers, being pharmacies, to utilize it. So I'm not sure the exact cost associated with that, but we've put substantial money in a lot of the governor's crime initiatives. We're focused on going after the large organizations, the criminal organizations, some of them related to the prisons, what was going on in the prison, but also on the street crime side. So I don't have that exact number for you at this point, but we can pull that out.
Well,
here's the issue, the cost of not doing anything is immeasurable. I mean, we've had more than 2,000 Marylanders die. When we declared a state of emergency. When you look at we declared a state of emergency on the riots in Baltimore, where no one died. We declared a state of emergency on the flooding in Ellicott City, where we had a couple of unfortunate deaths. This is a couple thousand people every year that die. It's more than traffic fatalities and murders added together. So this is something that we've got to address at the federal, state, and local level, and it's going to take more money, and it's going to take more effort, and it's going to take us throwing everything we can at it to try to stop it, or we're going to continue to have. And this is not just a Maryland issue. It's happening from coast to coast, and it's killing people. It's tearing apart families and communities, and it's not going to be easy to get out of it.
And there's also the medical community part.
Yes.
And there's a lot of money to be made by the drug companies and also by the doctors prescribing this. How do you get to the root of that problem?
Well, we're making real progress. So we've made progress on prescription
drug.
opioids, which about 80% of the initial heroin usage came from prescription opioids. We've cut that down. We have a prescription drug monitoring program.
Right, and from the prescription drug monitoring program, we can see that the prescribing of opioids has decreased substantially over the last several years. So the doctors are becoming much more aware of this issue. We tried to push through mandatory legislation. It was somewhat watered down, but it's to provide guidance to the doctors and to the hospitals with regard to prescribing opioids, limiting the amount of time, the amount of days that opioids are being prescribed. I mean, I know the governor has an example at one point where he was prescribed, 90 days of?
Yeah, when I was going through my cancer fight, I had multiple surgeries going on. I was with different doctors in different hospitals, and I had multiple opioids prescribed from different places. And I was like, if I wasn't so aware of this, I can see how someone could become addicted. We've tried to fix that problem. And look, there's no question that some of the problems of the pharmaceutical companies are to blame for the origination of this problem, but even they are starting to take ownership. People are so much more aware of the problem, and they're trying to develop a new generation of painkillers that are not opioid-based, that don't have the same addictive qualities. Unfortunately, it's difficult to find the things that work as well. So we're making progress, but that's a big part of the problem.
You had mentioned that this is a local, a state, and a federal problem. You also mentioned fentanyl. Mm-hmm. Much of the fentanyl in America does come across the southern border. And right now there's a fight over what to do in Washington with the southern border.
Yeah.
With knowing the damage fentanyl's doing, knowing much of it is coming across the southern border, where do you guys stand on the border wall issue?
Sure. Well, first of all, most of the fentanyl comes from China, and most of it comes through the U.S. mail. But some of it does come across the southern border, which is why I've been very strong on increased border security. I actually proposed a solution that I couldn't convince the president and the Congress to go along with, but I came up with a solution to actually push for the $5.7 billion in additional funding for the border security without this petty argument over whether we're going to call it a wall or not. So the president promised that Mexico was going to pay for the wall. Then he was going to try to get Nancy and Chuck to pay for the wall. They said, we're not going to pay for any wall. The Democrats supported border security under President Obama, but didn't want to pay for it under President Trump. And it's just absurd.
All right, thank you, Chris, and thank you, Governor Hogan and Lieutenant Governor Rutherford. Now we're here on stage with James Carroll. He's the Director of National Drug Policy for the Trump administration, and Steve Hsu, Director of Maryland's Opioid Command Center. Director Carroll, I think we can call you Drug Czar. Can we do that?
Please, Drug Czar works.
Because you are overseeing quite an operation. Tell us, what is the state of affairs with the the national drug policy?
At our office, we do have the oversight of all the federal government efforts and the bottom line is all of the efforts are dedicated to one cause that the president cares about, which is saving lives. At the end of the day, that's what matters, is we have to save people. And we do that through a variety of methods. We spend about $34 billion in the US on this issue, almost dead even split between law enforcement, interdiction, and treatment and prevention. And so that's what we're focused in on. When I took the job, the president said to be relentless, and that's what I'm trying to do every day.
Great. Give us some ideas of how you're spending the $34 billion.
It's a variety of things, and I'm really happy to say that they're paying off. One of the things that we're doing on the law enforcement side is directly out of the White House, we're funding our high-intensity drug trafficking areas. We're sending about $300 million to communities to get together to focus just on law enforcement efforts, state, county, local, federal law enforcement, coming together, working as one to go after the highest level drug traffickers.
So, if you know my story, my son passed away as a college sophomore at University of Colorado. He took a Xanax pill that was laced with fentanyl. He didn't know. He never woke up. Fentanyl. Now you tell me you're making some headway into the fentanyl coming into America. How are you doing that?
First off, it's through the leadership of the president. At the G20 down in South America at the end of last year, the president got a commitment from President Xi of China to do class scheduling of fentanyl. Almost all of the fentanyl that's coming into America originates in China. It either comes directly to the US through mail, or what's happening more and more, it's going to Mexico and then coming across our border. So we got the president of China to agree to up the law enforcement activities there. One of the other things that we're doing is, we just announced this at the White House about 2 weeks ago, is a prize challenge, $1.5 million prize for people to develop better technology at the border, at mail facilities, to be able to sniff, to detect fentanyl when it's coming in, so that people know. And it's desperately needed.
And you told me about a big amount of fentanyl that you've uncovered and gotten off the streets.
Just recently, about 2 weeks ago, and again, it's part of this task force that we have. It was in Arizona. It was someone who had come across where there's no wall, came across the border wearing a backpack with 29,500 pills. In this case, they were stamped and looked just like oxys that you see on the street, but they had fentanyl in it. But law enforcement were able to stop the individual, got 29,000 pills just off one backpack.
And the scary thing is, sometimes these pills have enough fentanyl to kill someone because they're not regulated. They're clearly not regulated. Director Hsu, tell us about what's going on the state level, your Opioid Task Force Command Center. What are you seeing?
Maryland's been hard hit by this crisis. We're probably, on a per capita basis, the 6th or 7th hardest hit state in the country, and it's a lot about fentanyl, as we've just discussed. Fentanyl is essentially synthetic heroin, but 50 times at least more powerful, incredibly deadly, very compact.
Where's it coming from?
It's coming from China, either the precursor chemicals or the finished product
I get that, but
itself.
how's it getting to Maryland?
Every imaginable way. Mostly overland. It's so compact and so easy to hide that it can come through the mail, through automobiles hidden in compartments.
What our audience may not know, and again, the reason why we're doing this is we're trying to create awareness, trying to lift stigmas. What you don't know is fentanyl. 3 or 4 grains of salt amount of fentanyl can kill a 200-pound man.
Well, and that's why upwards of 90% of all opioid-related fatalities today and cocaine-related fatalities today are related to fentanyl. The dealers are adulterating every imaginable drug in their inventory with fentanyl because it's cheap, it's powerful, and it's easy to hide.
And what I'm hearing also, there have been deaths. My son was one of them. Actually, the same weekend my son passed away, there was a Navy commander whose son was 19 years old, also from the Denver area, died of a fentanyl overdose, also buying a Xanax on campus. It was likely the same dealer, the same batch of bad stuff. Do we need fentanyl?
There is a legitimate medical use for fentanyl. It's been an available FDA-approved product since, I believe, the late 60s. It's used for very sick and suffering cancer patients, usually delivered by patch, sometimes by lozenges. It's not very often that legal prescription-grade fentanyl is diverted into illegal drug markets. It happens, but it's rare. It's this illicit basement mix fentanyl that is the actor in all these fatalities.
And Director Carroll, Chinese, you point out the Chinese. I think the number, I believe, is somewhere around 90% of all the fentanyl produced in the world is produced in China. And then some number like 90% of all the fentanyl consumed in the world is consumed by Americans.
Yeah, I mean, what I can say publicly is that originally it certainly was being produced in China, but now publicly I can tell you there's been at least 3 production labs, synthesis labs in Mexico for fentanyl. And so the precursors are going to Mexico, and it's now being produced there. We can't take our eye off any place, because if we squeeze hard enough one place, it will pop up someplace else.
Is this a national health crisis happening right now?
like we've never seen before, I believe. And we need the entire U.S. government approach. But at the end of the day, it's really a local issue. You're in the county, it's an individual who needs help.
Stay with me here for 1 second. Will a wall help?
Absolutely, no question.
How?
A wall will help, because if right now, the Border Patrol agents are scattered across the thousands of miles at the border. If we have the wall in the places where we know they cross, like this backpacker with the 29,000 fake Oxycontin pills, that means they will go to the ports of entry or other places where we can more tightly control it. And we can spin it the other way too. The people say, all we need to do is beef up the ports of entry. We can certainly do that. But if we beef up the ports of entry, they're not going to stop. They're going to keep pushing, and they'll find ways into this country where there's not a wall.
Well, speaking of ports of entry, Baltimore has one of the largest, most active ports in the country. Tell us about how we're stopping heroin and fentanyl and all the other opioids that are killing people or hitting our streets in a port.
Well, we work very closely with our federal partners on interdiction, because a lot of the material, the vast majority, if not all of it, comes from out of state, from the highway system through the U.S. mail, through second-day delivery services, every imaginable way. So it's very, very difficult. And that's why, while interdiction has a role to play, it's extremely important to expand treatment options to help people get into recovery. But even more important than that, I believe, is education, preventing people from becoming addicted in the first place. And that's why I really applaud you for taking the lead on organizing these town halls and getting the word out so that young people learn to stay away from these drugs in the first place.
We're going to delve a little deeper into that, the education, raising the awareness, and lowering the stigma to addiction and opioid use. But Director, I want to just ask you one more question. A lot of people point to, as Director Hsu pointed out, the FedExes, the UPS as delivery mechanisms, as distributors of these illicit drugs. Are we leaning on them hard enough? Are we asking enough questions to them?
We're leaning very hard. We, in fact, have formed an initiative at the White House, working with the National Security Council. We have brought them all in now twice. And I'll be leaving in 3 days, actually, and jumping on a plane to go to Kentucky to visit one of the facilities where they're actually checking it as it's coming in through the private carriers. And so it's important that we lean on them. But they want to also. This is easy for them. Not only do they want to do the right thing and stop it from coming in, but as we were talking about, fentanyl is so deadly, they're worried about their own employees being exposed.
I have literally only time for this answer. We talked to the DEA. Right. We speak to you. We haven't spoken to the FDA. Do we need fentanyl? If they make fentanyl completely outlawed in America, would that help your cause?
As the executive said here, it's no longer really being diverted. That's no longer the root cause of the addiction. And fentanyl does have its place. There are people who are suffering in chronic pain or who have cancer. What we really need is the education campaign. We're spending $300 million in 750 communities across the country to spread the effort on prevention.
All right.
Educating kids is key.
We're going to say thank you to James Carroll, Director of the National Drug Policy, the Drug Czar for America, and also Steve Hsu, Director of Maryland Opioid Command Center. Thank you guys both very much. We're going to put up the phone number for the opioid hotline. We do this in every city because we want you, if you're watching, if you know someone who needs help, call this number. It's 800-662-4357, the National Opioid Action Network. Get some help, have a conversation, talk to a loved one. If you think there's something going on, have that conversation. When we come right back, we're going to talk to Sheriff Gaylor, also the new Baltimore Police Commissioner, Mr. Michael Harris. We'll be back in a minute.
There's a very, very lucrative drug market. There's always competition for that, and that competition leads to feuds and violence.
All right, you've been watching shots of the beautiful UMBC campus in Baltimore County. We want to say thank you to them for hosting us. We're going to speak to Sheriff Jeff Gaylor in just a second, but first, Chief Michael Harrison. He's the new Baltimore police chief. He sat down with our Joy LaPola for an interview. Watch.
Let's talk about the opioid epidemic. This was a problem that you had to address in New Orleans. Do you plan to take the same approach to the epidemic here in Baltimore?
I think we're already doing that. I was a member of what we call the Opioid Task Force, comprised of all of the healthcare providers and social service providers in New Orleans, and certainly all the public service entities. And it was led by the health department in New Orleans. And so, yeah, we took the same approach. We equipped all of our officers with Narcan, taught them how to apply it, and then we made sure we were clear on, we were going after drug dealers, certainly in a strong way, but we were not over punishing people who were simply addicts. And so when we came across scenarios that we really believed people needed treatment rather than enforcement, we wanted to take that approach. And so we did that in New Orleans, but still making sure we were very strong about people who were dealing drugs, which is kind of causing the addiction and the lucrative drug market leading to the violence. So we were really strong there, but we really took a collaborative approach with the health department, who took the lead on it in New Orleans. And I believe there's a similar model here to make sure we're not over punishing or penalizing people simply just for being addicts who need medical treatment.
Right. How does the epidemic affect crime overall?
Well, people have to get their opioids from somewhere, whether it's illegal prescriptions or whether it's buying it on the street, whether it's pills or whether it's heroin or something else. And so there's a very, very lucrative drug market. There's always competition for that, and that competition leads to feuds and violence. Wherever there's drugs, there's money. Whether there's money, that's going to be a way to protect that money, protect that business. And so there's a lot of violence associated, and there's a direct correlation between that drug market, the competitiveness, and the violence, especially when it comes to groups and gangs that want to occupy geography. And so we've always studied that across the country, that correlation. And so we're working to eradicate that and root it out and make sure that we can, number one, stop drugs from coming in. But really what citizens told me across the 9 districts when I started last month was that they're tired of the open air drug markets right there in their neighborhood. Yes, they're concerned about the international drug war. Yes, they're concerned about drugs coming to the country, but what they're really concerned about is the drugs right there on their corner, in their alleys, behind their homes. And so we're working at every level here at the Baltimore Police Department with our local, state, and federal partners to have investigations to identify and eradicate and go after the individuals selling drugs that are, number one, causing these addictions. They're tearing families apart, and they're ruining the fabric of our society because it's become so lucrative, so violent, and it's such a competitive market that it's all tied together, and it's certainly causing people to have an eroded quality of life in their neighborhoods. And so we're faced with it on every end. But you know, I meet with our federal partners regularly, our state police, and there are ongoing investigations and collaborations to address it at every level.
All right, welcome now Harford County Sheriff Jeff Gaylor and Todd Edwards, Supervisor for the DEA Heroin Task Force. Sheriff, I'm going to start with you. Tell us, you just heard the gentleman before us, the drugs are talking about what's going on. Tell us what's happening in your district.
Well, absolutely. As you heard before us, there's no community in America that's immune from this. And Harford County, just north of Baltimore, we're certainly in the fight as well. One of the jurisdictions harder hit. I think we've taken an approach where we're not hiding from it. So a lot of people think we're the worst hit jurisdiction in the state because we roll out our numbers on our awareness signs as far as overdoses and lives lost. And so far, since we began tracking, we've lost in early 15, we've lost 261 of our citizens to this tragic epidemic.
So the reason why we bring the chief on, the sheriff on, is because we want to ask this question. Sheriff, we've been to North Carolina, we've been to South Carolina, we've been to Nevada, we've been all around Texas, Ohio. I ask the question again. Is there a Good Samaritan law here in Maryland? Tell us what it is and what it means.
Oh, absolutely. And actually in our county, we actually started the charge of not charging people who had overdosed or people who were seeking help even before there was a law, because it's the right thing to do. But the legislature getting on the bandwagon, they passed the law, I believe it was in 15, it might have been in 16, the Good Samaritan Act, which says, you know, if you've overdosed, you feel an overdose happening, or you're there with a friend and you need to call for help, you will not be charged with the crime.
Say that again. So if my friend is overdosing,
Right. Get them
I
help.
can bring my friend in, present myself and my friend, and say, we need help, he needs help, I'm not going to get arrested.
You are completely immune from being charged with any crime in the state of Maryland. So it doesn't matter that the Harford County Sheriff's Office has taken this approach. The legislature has protected those people, and that's the way generally the police want to help. They want to overcome this, and like us, they're targeting the dealers for sure.
Honestly, I think this is one of the most important things, one of the most important changes that law enforcement has done to combat the opioid crisis. Listen, if you have a friend who's overdosing, we love you. You're not going to get in trouble. You're not going to get arrested. You're not going to get thrown out of school. You're not going to get thrown off the football team likely. Get some help. Todd, tell us about, you told me a couple of stories in the break. I want to hear those stories. I think people need to understand how prevalent this situation is.
Yeah, so once again, thank you for having us here. First of all, we did a case a couple of years ago which had basically everything that we've talked about. We had fentanyl, counterfeit Xanax, which I know it goes near and dear to your heart. We had a dealer in Baltimore County that was making them in his parents' basement and shipping them all over the United States through the dark web and being paid in Bitcoin.
He was adding fentanyl to.
He was adding fentanyl.
Right,
correct. He was also using prazolam, which is the active ingredient for Xanax. But he was also putting fentanyl, taking orders on the dark web. We had actually traced some of the fentanyl that he was getting from China.
Listen to this. Listen to this. This camera. Listen to this. Fentanyl being mixed in someone's basement in a Xanax that looks like a prescriptive Xanax. I'm going to talk about it at the end. My son, it happened to my son. One pill can kill. Am I right, Todd?
Correct, Eric. And this is what we want to get out is nowadays, fentanyl is the killer. In Baltimore, heroin deaths are actually, overdose deaths are going down. Fentanyl is skyrocketing. And it's going to be like that all over the nation. And dealers don't care what they're doing to everyone. They don't care if people die. And this fentanyl is going in everything. It's going in heroin. It is going in counterfeit medications like Xanax, like Oxys. You're at a party, you might think it's a regular Oxy.
They're putting it with cocaine now.
Putting it with coke, putting it with cocaine, putting it with meth, anything.
Sheriff, tell us the change. Have you seen a change in how people are using these drugs?
Oh, absolutely. And we send out a drug investigator on every single overdose, and that's two-pronged. We want to target those dealers. I want as much information to go after them as possible, but we also want to steer that person toward treatment and help, God willing, they had survived the overdose. And we are seeing, just what you heard, more and more fentanyl. And the addiction is such a powerful thing to try to overcome for those who are not just an accidental overdose, but truly suffering from addiction. It's so hard for them to try to overcome that they're actually looking for the harder drug. If they know something has a synthetic fentanyl or carfentanil, they want to buy from that dealer.
The craziest thing I've ever heard that I've learned, and again, I'm becoming an expert at this, which I clearly did not want to be. The craziest thing I've ever heard is if a dealer sells a drug to an addict or to a user and they die, the dealer becomes instantly more popular.
That is 100% correct.
That is just a scary concept. Tell us about Narcan, the reversal, the opioid overdose reversal drug. Do you carry it?
Oh, absolutely. Every police officer in our county, the municipal agencies, the sheriff's office, the state police, we all have it, and we get a lot of use out of it. Thank goodness it's there, because it gives us an opportunity in so many cases, along with EMS, to intervene and save a life and give them one more chance at trying to go down that road to treatment and hopefully addiction, getting away from the addiction.
Todd, one of the other most important things I think we've created or we've stirred up in these town halls is that it used to be heroin. The opioid overdose used to be heroin. Now it's anyone, almost anyone you talk to. I'm a TV host. We were in Las Vegas with a performer. It touches just about everybody.
It touches us. It touches federal officers. We have federal officers who have been impacted personally through their family and with overdoses. We are part of the community also. I have a 14-year-old son and a 12-year-old daughter, and it scares me because you just don't know what's going to happen. And one of the problems is that because you don't need that much fentanyl, that the dealers can. It doesn't take a lot to get someone high or to kill somebody. That the profit margin is incredible, and that's what's driving it. And in places like Baltimore, I've worked for almost 24 years, that drives the violence.
I'm going to say it again. You're not going to get arrested if you show up, you present yourself or present someone you love or just friends with if they're overdosing. go to the hospital, go to the police station, go get some help. Just make the call and get some help. I'm going to say thank you very much to the sheriff and also to Todd Edwards. Thank you guys for joining us here. We're going to come back with Nick Alba. Dave Bratt's going to be here, a good friend of ours from Liberty University. He'll be here a little bit later, but we're coming right back with Nick Alba. Stick around. Welcome back. Joining me now, Nick Alba, the Amatus Health Director, and UMBC's right here, Dr. Carlo DiClemente. Doc, I'm going to get to you in a second, but tell us about Amatus, and you guys are a recovery system nationwide, right?
Correct. Yeah, so Amatus...
Is anything working?
A strong continuum of care with a multidisciplinary approach is, in my opinion, and I'm sure Amatus's full opinion, that is the best recipe right now.
How much is enough? How much is a strong? You mentioned strong. Is it 30 days? Is it 60 days? Is it 90 days? Is it longer?
We're talking longer. We're talking up to a year and a half, 2 years, starting from getting them off the drugs in an inpatient setting, all the way down to, twice a week in outpatient and anything in between.
How do you get someone to stay a year in a treatment center?
It comes down to the motivation. Right, so myself, I'm in recovery. I've been in recovery for over 10 years. Mm-hmm. When I was 19 years old, I was arrested for the last time, and I just said I had enough. And the judge was grateful enough to give me a chance and send me to treatment.
All right, doctor, tell me what you see on campuses like this.
So I think a variety of problems on campuses like this, like you were saying with your son, the non-prescription use of prescription medications, people are using study drugs. They're using a variety of drugs to.
When you say that, you're talking about Ritalin and the others.
Right. Buying some of the Adderall and the Ritalin and some of the drugs that are used that way. Anxiety
drugs. What are Ritalin and Adderall really? I mean, a lot of people say it's for kids with attention disorder, deficit disorder, to be able to focus and study. But isn't it more like it's an upper?
It's speed. It's really kind of a medication that actually gives you a little bit of a bump, and it does help focus. So that's the parts of it that you really want for ADD or ADHD. It does help people focus and to calm down and to do a little bit more planning. For people who don't have ADHD, it's much more of just an upper that allows you to kind of focus, stay awake a little more, be a little more engaged in your activities. But there's a payment, so you crash afterwards. And that's really the biggest problem, is that you can do that for a while, but you can't do that for very long.
Nick, what are you seeing, again, is it heroin, is it opioids, the most addictive substances that you're finding?
It's opioids, definitely, and not just heroin, but fentanyl, prescription opiates, the whole entire class of that drug.
What's the hardest behavior to break?
The lifestyle and the rush and the feelings that someone get when they use it. And like they spoke about before, the drug dealer that kills a person from an OD becomes the most popular because that's what people are looking for.
Tell me this: you have, let's say, an 18-year-old son or daughter who's a great student. He or she does not want to go into recovery, and you think there's a problem there. How do you get that person into a recovery system? You need a court order, right? A doctor and a parent signing off on putting someone who's an adult into recovery. Yes.
You could get a petition to have them put into. It's more for mental health, but you could have a petition to have them put into some sort of treatment. In the state of Maryland, they don't necessarily have a petition to put someone into substance abuse treatment if they're over the age of 18.
Gotcha. Doctor, your thoughts on that?
So I think, we really have to work on the motivation. So I do think that there's a lot of other strategies. So we talk about the community reinforcement approach, teaching families how to kind of engage their individual, how to bring them into treatment, how to kind of talk about with other professionals about the dangers and what's going on with that particular individual. If a family's seeing it, it probably is a little worse than they really think. because normally you can hide a certain amount of this. When people start recognizing and seeing some of the things, then they begin to realize that there's a problem.
Can you tell our audience about Noxolone or Narcan?
Sure. I mean, I think that because we are dealing with people who are addicted, and when you have an addiction, it changes the brain. It changes the way people function. It changes the pleasure and stress mechanisms in the brain. It reduces their self-regulation, and it takes over their lives. So people do things. We're doing a project with pregnant women, and it was really interesting to hear the woman talk about, I tried to get off when I was pregnant because I wanted to protect my baby. And then after a while, I just couldn't do it. So there's a sense that there's a loss of control. And so when that's happening, it's very difficult for the individual to make good choices. So that's where you need the support, you really need the structure, and you need to do harm reduction. So this person who's not making good choices, you want to have them at least alive for another chance. So that's really what you want to do with the Narcan.
Nick, talk to us a little bit about this. And again, I'm doing this for the audience to understand. If you go into recovery, a lot of people, a lot of addicts or people who are suffering, when they leave recovery, they die because their body is not used to doing the same amount of drugs that they did on the way into recovery. Is there a way to follow these people, make sure they're not jumping back into the levels that they were prior to coming into recovery?
Of course, and that comes with general follow-up and calling them, twice a week or once a month after a while and checking in on them and seeing how they're doing. A lot of our treatment facilities and other treatment facilities offer alumni support once a week and family support in order to, like he said, the community integration and bringing everybody together, because it's not just the person who's suffering. As you know, it's the family as well.
Don't I know? A sponsor, in AA there's a sponsor, where if a person feels like they're going to take a drink when they shouldn't, they call the sponsor and the sponsor says, stop, I'll come help you.
Right.
Is there anything like that with drugs?
Yes. So there's 12-step programs, along with Alcoholics Anonymous, that look at the drugs as well, because that's becoming more prevalent over the years. And being in recovery, it's not just the alcohol, it's not just the drugs, it's the disease, right? So there's a lot of things coming out about gambling addiction, about sex addiction, about video games. Being addicted to video games is the brain disease that's coming out now. It's not just the drugs.
Doctor, this is an important topic. I think a lot of people have been doing recent studies on what is triggering the addiction. Is it our cell phone? Is it our constant need to look at something and get support and get more views or more tweets or more retweets that gives us pleasure zones that resonate? And if we don't get it here, we're going to do it by taking something?
So I do think that behind some of this is what I call kind of a crisis of meaning. I think that for the addicted individual who is kind of searching for the high, they're searching for something. And I don't think it's the high, because basically what happens with addiction is the high wears off and you don't get, people who begin are not, for the certain reasons of getting high, are not the reasons that they actually continue. They continue to avoid withdrawal. They continue to feel normal. They continue to kind of have a sense that, and why they're looking for this next high, why they'll buy something that killed somebody else, is because they're not wanting to be just normal. They want to be more than normal. They want to have that, they want to recapture that high, just like people in gambling want to recapture the win.
That's why they're using the fentanyl. Very quickly, is marijuana a gateway drug to harder drugs?
In my belief, yes, it is. It is. And not only just because of the feeling that you're chasing, but along with that, it's the people that you're surrounding yourself with, right? So for myself, in my personal story, marijuana was the first thing I did with the group of friends that I started to hang out with. And they were the ones who introduced me to the other drugs, the harder drugs, that got me to where I was when I was 19.
You see this in recovery too?
All the time.
That marijuana was the gateway. It's a causation, not just a coincidence?
It's very rare that you see someone who the first drug they ever did was heroin.
What do you think, Doc?
So I've actually done a lot of smoking research. So smoking was considered the gateway drug a long time ago, that it was tobacco that got in. And we've done some work looking at Maryland teenagers and looking at what they do. Many of them, if you start using, the big issue is if you get past one substance and start using another substance. So we know that kids that smoke, 80% of them or 70% of them have tried marijuana. Of the kids who use marijuana, many of them will try a different kind of drug. So I think there are different paths in. I don't think it's necessarily just marijuana, but I do think that as soon as you go past that, you break the barrier and you start getting your brain associated with different chemicals.
I only have less than a minute.
Yeah.
Let me stay on this for the topic of smoking, vaping. Is this an enhanced smoking high that's given that people are they need more?
So again, all of these substances change the brain. So nicotine is an addiction. I mean, it's an addictive substance, and when you kind of get addicted to nicotine, you have some of the same things that happen in other addictions.
Is vaping delivering nicotine at a higher dosage and quicker?
Yes. So some of these substances, some of these vaping tools deliver a pack of cigarettes in a pod.
The whole pack?
You have a whole pack of nicotine in one pod of the vape. So yes, you have to really be careful with that because you don't know exactly. It also is unregulated. So we don't know what's in there. We know that people are using some of these things for marijuana. We also know that it can be adulterated. So there are that's why prevention is so really is very important.
We're going to leave it there. We're going to say thank you to Nick Alba and Dr. Carlo Di Clemente. Get some help. You need help. You're watching this. You got a friend, you got a family member, you got a coworker. They need help. Get some help. Don't wait until it's too late. All right, we're going to come back with Liberty University's Dave Bratt, also a good friend of mine for a very long time. We'll be right back. All right, we're back, and as promised, Dave Bratt, good friend of mine, former congressman, also dean of the business school at none other than Liberty University. If you see the logo right behind Dave Bratt's head is Liberty University. Liberty's been just fantastic sponsoring these opioid town halls. Give us an idea, give us a sense of what you're seeing. Now, you're around classrooms a lot.
Yeah.
You have a lot of students. What are you seeing?
Yeah, well, Liberty is just a great community. It tees off of what you guys were just talking about. One of the gentlemen just mentioned a crisis of meaning, and at Liberty we take that seriously. And so the issues, when I was in Congress, you see when it comes to recovery, the sheriffs that I worked with were the superheroes that I worked with. And the people that have an immediate need, when they're in crisis mode, that's an issue. I had parents come to me in terrible conditions. I don't know where to go. And that's a big issue. Well, the one place they can go is the sheriff, the community organizations, the church, et cetera. But the sheriffs are positioned, they have hundreds of beds. But none of the federal funding is getting down to recovery with the sheriffs yet. They're running hundreds of beds. Carl Leonard in Chesterfield County is New York Times award-winning programs. They're funding it out of a normal sheriff's budget. Mike Wade in Henrico County, same thing. And so we had the Cures Act in Congress. We passed as $1 billion out of about a $6 billion bill. Half that money went to opioids and to the states, and then state money still doesn't make it down to the localities. Well, the localities are the folks who can make a difference. The community organizations, Liberty University, the churches, the sheriffs. And I think we got to do a better job of getting the $1 billion, right? At the state level, it's in the tens of millions. It's not enough to do it. And your other speaker said the time frame we're talking about is a year. Well, all the funding formulas are tied to about a 30-day max. Yeah. And so how do you scale up? If this is a national tragedy, how do you scale up care and recovery and concern for people? And it's obvious that the church is going to have to play a key role, the family's going to play a key role, and we better figure out how to scale up the solution for recovery, because it has to last that long. And Liberty University, of course, that's what we do. Our students study these issues. We live in a faith community. We're proud of that. We believe in second chances for everybody. And our community comes together to support events like this. The President of the United States and Melania, is the First Lady of our country, is helping out and did a great town hall at Liberty. And then our President at Liberty and Becky, our First Lady at Liberty, are spreading the word.
Huge supporters. In fact, last week we were in Las Vegas with the First Lady.
Yep.
And Jerry and Becky Falwell flew all the way out to Las Vegas and sat on a panel with us, and we talked about faith, how my faith has been rocked since our tragedy. And it was amazing to be able to talk to them.
Great.
You were in Congress. It's one issue, I think, that is, it's probably the only issue that's nonpartisan.
Right.
Nonpartisan.
Right.
People realize
Bills passed.
This is a big
Huge
problem.
Right. Bipartisan wins. We all get along. We all want to help people. When someone's in crisis and need, your heart goes out to them. I had town halls on the issue as Congressman. We had people come from women's centers and young girls, 20 years old, testifying to their life ravaged by not only drugs, but everything that goes with it. And it just tears your heart out. And so, we had bipartisan agreement. The bills passed overwhelmingly, and it's not just the money. We need to set up in our communities, organizations, take the stigma away from these kind of things.
Dave. That's so big.
Right.
So how do your Liberty Christian University? Is there a stigma for opioids with opioid use? If someone presents themselves and say, "I have a problem," will they get thrown out of school?
No, absolutely not. I mean, at Liberty, I've been so overwhelmed by the love there, and that's what has to come out. And at Liberty, the students, there's not a judgmental bone since I've been there. Everyone's been welcoming to me. They're warm. If people have problems, we believe in second chances. And
it's
that's
not just Liberty, though. And granted, yes, everywhere we've been, we've talked to people. We've talked to lawmakers, first responders, people from the institutions, the colleges. 100% across the board, you're not going to get fired. You're not going to get thrown out of school. You're not going to get arrested. You got a problem, talk about it, make a phone call, you'll get some help.
Right, and that's more the issue, that the parents didn't know of the young ones. They're stunned in disbelief, and it's more a matter of education, what you're doing. The power of these drugs is unimaginable. The average person that doesn't know about it, hadn't been educated yet, cannot comprehend the power of what's going on with this fentanyl. And one time, and tragedy strikes. And so that's the part we're doing now is just getting the word out. And I mean, I'm the dean of the business school, and I was pleasantly surprised to see the chairman of the Federal Reserve this week on 60 Minutes, right, and saying, it's not just a crisis of meaning, but this is showing up, the meaning shows up in the workforce, the skills mismatch, people unemployed, depression. And he said, we have a cultural problem. This is a massive cultural problem. And so K to 12, I think we got to do a little bit better instead of just teaching to the test.
It's amazing. We have people, first of all, we've had people call our stations or email us and saying, we quit because we watched the town hall, and keep doing that because this is getting the word out. But think about this for 1 second, Dave, and you can weigh into this. 72,000 people died of overdoses last year, mostly the opioids. That's like flying an airplane into a wall every single day filled with 200 people and everyone dying every day. Do we have enough funding to fight this crisis?
No, I don't think so. And the funding that we have it gets trapped at the state level, right? And so you had the drug czar here. But the drug czar is just the drug czar of federal dollars. And then our government was never intended at the founding to be all up in one city in D.C. with a $4 trillion budget. That wasn't, and it's showing up here. The failure is showing up because the logic there's not a czar over the state strategy, which should be huge. And everyone on the stage here today said the locality is what really matters. Well, so it's inverted. Most of the money should be down at the local level, and then the state, and then the Fed, right? They can do some research, and that's hugely needed, but
listen,
that's it.
You guys have been great. Liberty's been great. The Falls have been great. UMBC has been great. David, I really appreciate your time. Sit there for 1 second. I want to say thank you to everyone involved in this town hall. Say thank you to Governor Larry Hogan, directors James Carroll and Steve Shue. Fox 45 News has been terrific. They're putting on the production here, WBFF TV in Baltimore. Sinclair, you are amazing. We've been around the country. We continue with 4 or 5 more of these town halls. UMBC, like I said, and our partner, Liberty University. I want to say thank you to all you. A couple of parting thoughts to parents. Not my kid syndrome is deadly. Your kid is not too smart, too beautiful, too athletic, too white, too black, too rich, too poor, too Hispanic, too Muslim, too Christian. It will cross their path. Have the discussion. And also to kids, my son, Eric Chase, we shared clothes. He took 1 pill. It was laced with fentanyl, killed him. Remember, 1 pill can kill. Make the phone call if you need help. Good night, everybody.
Your Voice, Your Future Town Hall, Opioids, a national crisis, has been brought to you by Liberty University.
If you or someone you know is struggling with addiction, reach out to us. We are available 24 hours a day. Visit us online at AmetusRecoveryCenters.com or call anytime at 833-754-9297.